right. Well, hi, everybody. Good afternoon, good evening, where you're Zooming in from, and it's very nice to be a part of this today. I've known Jill for many, many years and have worked closely with her and the acromegaly community for years. And as Jill stated, I started back at Cedars-Sinai Medical Center running the acromegaly support groups. So it's been nice to be able to speak to you a little bit about my perspective as a psychotherapist and how I work with my patients on coping with pituitary disorders. So let's begin. Some of you may have seen this presentation before. I use it very often because it's something that can be repeated, and every time you will find you'll get a little bit something different from the presentation. I'd like to start with kind of the objectives of what we're going to be focusing on today. The majority of the time I work with patients with acromegaly, other pituitary disorders, chronic illnesses, is that there is a identity shift that I find a lot of times with my patients, is that they've gone through their life very healthy, and when they're hit with a diagnosis, a medical diagnosis for the very first time, it tends to kind of just overwhelm them. And there's a lot of identity issues that come about where they just feel like that's all they are. That's what their life is today. That's who they are. That's how they identify, that it kind of takes over. And so one of the things that I think is really important is that letting people know you're not that diagnosis. You're much, much more. It's a part of you. It's a piece of you. You didn't control it coming into your life, but now we have to learn how to cope and strategize. It's important to know as patients that physiological, psychological aspects are connected, right? Our body and our mind and our emotions are all very connected. So we're going to talk a little bit about how we kind of see the situation, how we think about things, how it affects our emotions and ultimately our behaviors. And with everything going on in the world, civil unrest, the pandemic, hopefully you can use some of these tools in your life outside of pituitary. How well you learn to cope with anything in life is going to affect your well-being, and you're going to learn more about who you are and how you want to live your life. There's a lot of choice in what we have. So the goals here are we're going to identify some psychosocial stressors. Now, if we were all in a big conference room together, which I wish we were, like in the past, I would ask a lot of you to raise your hands about some of the psychosocial stressors that you've been experiencing with a new diagnosis or throughout your self-care. And those are going to be different for everybody. There's going to be psychological challenges. Right now, there's a lot of people dealing with mental health issues, especially around the pandemic, especially around chronic illnesses, having an underlying medical condition, how vulnerable we feel to the pandemic. So those are challenges that each of you are going to be dealing with individually as well. Right now, we're dealing with a lot of social challenges. We're going to focus on how you cope and how you understand how your thoughts about your diagnosis or the world today affect your mood and behaviors. So, first of all, when we're confronting a diagnosis, and let's open up this presentation even more to like everything that's going on in the world. You're probably focused on things outside of your body as well, is that our personal security is very disrupted. I mean, if you would you not agree that when you're first diagnosed with any kind of medical diagnosis, it disrupts who we are. If you think about the pandemic, it's affecting people's mood, more anxiety, more depression. So it's kind of looking at how do we incorporate this new information into my life? If it's a new diagnosis, or if it's an additional medical complication, how am I handling, how am I coping with this new information? Am I moving towards depression? Am I anxious? Am I withdrawing from friends or family? How are my relationships? So as a licensed marriage and family therapist, we're focused on relationships. We want to look at how are those impacting you and what your feelings and thoughts are contributing to that. So one of the things that's most importantly dealing with a pituitary disorder, and we deal with acromegaly, is daily maintenance. And it's just not daily medication maintenance. It's also psychological maintenance. It's the things that you do for yourself every day to keep you emotionally, medically, psychologically fit. I think all of us, when we have a chronic illness, we need to look at how we can be our own advocates in taking care of ourselves daily. One of the things that's a challenge in the beginning when we're dealing with an acromegaly diagnosis or other chronic illnesses is medications, side effect, titration up or down, how we can see how the medications are going to affect our bodies long term. If there's persistence of symptoms, what kind of resources are out there outside the Western, let's say medicine arena to look at how some of these treatments, whether it be acupuncture, acupressure, massage therapy, pain management therapy to deal with some of these symptoms. Those are very important to look at, to weave those in with not just the Western medications. And then the global kind of question that we're all grappling with today is, what's all this? How are we maintaining all of the above? What's my view? Is it more positive? Or am I more kind of despondent about the future? And we'll go into some of these coping mechanisms. Social challenges tend to be more on the high side with those with pituitary disorders, also with chronic illnesses, because there's a lot of changes in one's body. There may be changes in one's moods. And so it's important to ask yourself, how am I contributing to that? Am I isolating more? Am I turning down social activities? Am I less interested in things that used to give me pleasure? That last question is important because that's a chief indicator of a depressive mood. And so if you're pulling away from things that used to give you pleasure, whether it's reading, or gardening, or talking on the phone with friends or family, if you find yourself kind of pulling away from those things, we need to kind of check in and look at, is this more of just having a hard time adapting or adjusting to a major change like a diagnosis or even a pandemic? So those are some of the questions that I want you to ask yourself as we're going through these slides. I want to talk about coping. I'm a big believer in how people cope. I'm kind of fascinated about this personally because we all cope in different ways. So we're going to go over some of these. Now, the definition of coping, as you can see on the screen, it refers to specific efforts, behavioral, psychological, which people use to master, tolerate, reduce, minimize stressful events. Okay, so that's how we cope. And for the most part, human species, and we've been around for a very, very long time, tend to do well with coping. We've survived many years and we continue to by developing coping strategies, not just as individuals, as families, as systems, as cultures, as the world. We work together on coping with stressful events. So I've done a lot of work with patients in my treatment rooms dealing with ways of coping that may be of help to you during today's presentation. So this is very important. One can use each of these types of mechanism within a given situation. And we're going to go over the 5 main types. The goal here is to identify what is your primary way that you cope with stress. And remember, these are interchangeable. One day you may feel very strong, like a personal advocate, like a fighting spirit. You're a conqueror. You're just feeling really good about your recovery, what you need to do to take care of yourself. The other days that you may not feel so strong, and it can, kind of weave in and out of who we all are. And what's important is that a lot of these coping mechanisms are choices, but not to beat up on yourself if you find that you're feeling stronger one day and not so strong another, because that's going to happen to all of us. So again, if we were in the large room where I could ask you to raise your hands, I'd want to find out how many of you have this kind of fighting spirit inside of you, where you feel like you can conquer this. This is a challenge. You have a positive attitude towards your outcome. You're an active player in your recovery. You're active, meaning that you show up at your doctor's appointments. You have a pad of paper and a pen. You take notes. You may bring somebody with you kind of as a backup. The phrase, I have acromegaly, it doesn't have me. It's not everything that I am. It's a part of who I am. So this is a great coping mechanism. Now, not to say that you have to be here all the time, or that some of us are more than others. It's just a place that see if you go to when you're dealing with coping issues. This is a very common way that a lot of people cope. I'm sure we've all been in this place, and we know people who kind of go to a place of avoiding problems, denying the problem, minimizing the problem, where we kind of move into unhealthy, maladaptive coping behaviors, overeating, smoking, alcohol, drug use. If you think of all the things out there that we do as human beings to just kind of cope, where we're not feeling that strong and we're needing something to help us out, we want to be aware that we're not living in avoidance and denial. One of my quotes that I've heard a lot of my patients say is, my symptoms will not go away, and it's not that serious. Kind of minimizing really what the headache, or I've got this headache behind my eye and it's been there for a while, but it's really not that bad. This is another type of coping mechanism. Now, try not to judge yourself as you read these. Don't judge the coping mechanisms. Judging is when we kind of place good or bad or yes or no. These are just the way we as human beings kind of move out of stressors. So this is where we kind of have this passive acceptance. Again, we're not in this active role of, attacking what we need to take care of ourselves. It's more like it's all in the hands of fate. I don't need to do anything. It'll go away. I mean, just kind of having this fatalistic kind of viewpoint about life, which I can tell you that a lot of my patients right now are in fatalism in regards to the pandemic. Worrying about when will this go away? How will this go away? Just kind of accepting it, but in a negative fashion, getting stuck more into how, rather than focusing on this will not always be this way, more succumbing to it, that like the world is doomed. So that's that fatalism coping mechanism. So if we were in a large room all together, I would ask you all to raise your hand to see if any of you have felt helpless. This is a very common coping mechanism. We've all been here. We'll go back here again. But you don't want to be living in hopelessness or helplessness, where you're so overwhelmed by the state of affairs that you may be focused on loss of life or impact of change in lifestyle, where you can't control anything, where you're completely kind of suffocated in the negativity of this. So when we tend to be in hopelessness and helplessness, this is where it's very important to talk to somebody in the acromegaly community, talk to a dear friend, talk to a professional like myself who can treat this type of possible mood disorder. A lot of times I've heard patients say, there's nothing I can do, what's the point of going on? So you want to be mindful of how we can kind of get in our head and start to spin about what the future is going to look like. Or because I have this diagnosis, this means this, this, and this, without any fact finding that that is going to be the case. So this is, we all again go into this coping mechanism, but we want to not live here. So anxious preoccupation is very, very common. I think it's very common right now with what's going on in our culture, in our society, with our news, with being anxiously preoccupied. This is compulsively searching for assurance. This is where you're doing a lot of self-diagnosis, a lot of times worrying about the disease coming back, or any physical symptom that pops up. We kind of get into this self-fulfilling prophecy that this is going to be a new disorder, this is a new problem. And so it's dealing with uncertainty about possibly exerting control, trying to find control. Very common. I've got a lot of patients that say, and I'm sure you've heard colleagues and friends, family members even say, I can't cope with not knowing what the future holds. A lot of people are struggling with this right now. So life is full of stress. There's good stress, there's bad stress, there's positive stress. Like I was struggling with getting my slides up for this Zoom presentation today, and I was feeling stress. So, you know, finding a coping mechanism to know in my head that we'll figure it out. And if we can't figure it out, I could still give the presentation. So it's looking at what you can control in life and what you can't control in life, okay? So with a chronic diagnosis of an illness, there's a lot that you can control and there's a lot that you can't control. So controllable issues are, you can choose your doctor to see. You can choose which team you want to work with. A doctor that has some sort of a bedside manner, someone who's going to take your phone call, someone's going to listen to you. And if he or she can't, maybe there's a nurse practitioner on the team that can be there for you. You can choose to some extent what procedures that you want to have done. You know, in regards to the ones that your doctor are either promoting or suggesting, you can look into different medical management. You can look at different surgeons to really deal with what's controllable, what you can be in charge of and act as an advocate. And then there's definitely going to be stressors that you can't control. None of us can control issues. The fact that we have a tumor that's grown, the fact that we chose to had it treated different ways, the fact that you can look at what you can control will divide between what you can and what you can't. So this is very important, to look at what you can and can't control in regards to your disease. So how do we cope with controllable stressors? Okay, so we want to utilize strategy, problem solving, decision making, finding information, setting goals, feeling in control of the decisions that you're making. There's nothing worse than feeling out of control or feeling like you can't make a decision. So it's important to kind of look at what those decisions are and unravel them. Where can you control certain decisions that need to be made? You kind of want, this is again, kind of coping with controllable stress, is being that active player in your recovery. Okay, this is where you can control certain stressors. So how do we address issues that we can't control? There's a lot of stress right now in the world. There's a lot of stress with chronic illness. We can't change a lot of things that are happening. So how can we cope with some of those? So this is where we need to practice a lot of self-discipline and looking at our emotional response. Maybe looking at our thoughts, how we think about a situation, how we express our emotions or our behaviors. So what are some of the things that give us pleasure? How do we take our minds off things that are causing us pain, sadness, depression, anxiety? You know, what are those things for you individually? Is it waking up and doing a mindfulness exercise? or a meditation, making sure you get enough sleep, or that you're monitoring your sleep hygiene or what you're eating. These are the ways to cope with things that we have no control over them. So I want to talk a little bit about managing symptoms, because the last conference, this was something that a lot of you brought up that was important at the time, was how do you deal with the breakthrough symptoms? You know, how do you deal with, despite receiving treatment, you know, with different medications? How do you deal with having a GH and IFG1 levels in the normal range? Or how do you fight fatigue, body aches, joint pain, sweating, headaches, especially around the fact that a lot of doctors who are treating you will say that they've done everything and that you shouldn't be having these breakthrough symptoms. I've talked to a lot of patients that struggle with the dialogue oftentimes with their doctors about breakthrough symptoms. And, you know, despite the medication that they take, you still have these moments where the levels are off, and the symptoms, even like prior to surgery, are back. So this is really important to kind of manage this with your doctor, you know, have a medical journal, you know, document when you're feeling these symptoms, notice if there's any trends, notice the time of day. Those are being that, you know, fighting spirit kind of advocate for you to go into that doctor and say, look, this is when this is happening. It doesn't make sense to me. I'm receiving treatment, but I'm still struggling with incredible fatigue. And even looking at what other resources can address some of these issues with pain management, massage, things like that. So managing symptoms is really important. A lot of this also falls into what you can control and you can't control. So utilizing mindfulness, meditation, you know, pleasurable activities to kind of handle these symptoms that are so difficult. So a couple of the things were mentioned at our last conference about acro rage and the fog that people feel. You know, acro rage is defined as just the biological changes in the body caused by medication or caused by the tumor. You're going to find mood swings. And a lot of times family members who I also work with will say, I just don't understand why he or she is so angry all the time. Be fine for 1 minute and there'll be this complete mood change, kind of like a roller coaster of emotions, and why can't the person control that? Well, there are physiological facts that acro rage is real, and these are biological changes in the body. So be gentle on yourself if that's what's happening, if you're experiencing it. Again, I think journal writing, noting it, seeing if there's anything triggering it is very, very helpful and something to monitor with your doctor. We also see a lot of times with clients with acromegaly, memory, even like memory loss, just cognitive impairment, forgetfulness. We're not talking about dementia. We're not talking about Alzheimer's disease or any other kind of dementia. We're just talking about a fogginess, if you will, is what patients have described it to me as, that is real. Again, a physiological, biological change in the body that is, that many, many patients experience. So again, through education with your physician, this is something to be mindful of that is real. And a lot of patients deal with this, and a lot of times patients have to describe what this is really like so their families understand them, and so that they can gain support from their loved ones. So I want to talk a little bit about a type of theory that I use. This is a very common theory that a lot of psychotherapists use to treat psychosocial stressors. Okay, the idea is that there's a relationship between our thoughts, our behaviors, and our emotions. So if we look at the diagram on the slide, you'll have a situation. It's connected to how we think about it, which is then affects our emotions, how we feel about things, which then usually triggers our behaviors. So the situation is the one thing that doesn't change. And that can be anything. The situation can be the fight that I had with my husband last night. It can be a chronic illness situation. It can be the pandemic. It can be whatever it is, but the situation is the thing that doesn't change. So if we take this diagram and we put it towards the diagnosis of a chronic illness, that's the situation. That's unchangeable, right? It's happened. What's the thought that we have about it? If we have the thought, I'll never be the same person, the typical emotion that's connected to that thinking process is fear, sadness, depression, add in anxiety. It can be whatever, your flavor of a negative emotion. But if we think a certain way, that's the idea of the theory. If you think a certain way, it's going to affect how you feel. And then when we're thinking poorly and feeling poorly, 9 times out of 10, the behavior that follows is also going to be something that's probably not in your best interest. Something negative, like withdrawing from a social situation, withdrawing from a conversation that you need to have with your partner, because you're already in your head, you're thinking about what the outcome is going to be. Right? So when you look at, on this slide, when you look at number 2, thought, I will never be the same person, the word will, that's future tense. You're way out of the here and the now, right? You've made a decision that you're never going to be the same person. Well, remember from the beginning of this presentation, having a diagnosis or living with a pituitary disorder is a part of what life planned in your life is happening. It may be something, it may be cancer with somebody else, it may be blindness with somebody else, diabetes with somebody else. It doesn't change who you are as a person. It just means that you've got to adjust and adapt and work your life around this. So notice how you think about things. So I'm going to read these bullets out, each one. A situation need not change in order for you to change the way you feel. Okay, now that's the power of this theory. A situation may not change or will not change depending on what the situation is, and it would not affect, again, or in order for it to change how you feel. So the way a person thinks about a situation determines how you may think about it or feel in your reaction to it. The theory then is, if I change my thinking, which is the hardest thing to do, then you may change how you perceive the situation. Okay, a lot of people right now are struggling with issues depending on where you live right now in the state, focusing on the pandemic and your views on it, how your state's handling it, your community, what your thinking is, what's the societal thinking around it. So it's very important to stay in the moment around it and do what you can rather than future trip and think about what it's going to be like in a month or 2 months or what the economy is going to look like in a year. It's about what I can do about it today. So something that's important for people to know that I work with and my clients is our thinking. So a thought, these are called automatic thinking. A lot of times, depending on how we were raised, what we learned in school, what we learned by the earliest teachers in our lives, is how one thinks. So a thought can be so well rehearsed that you don't even need to think about it consciously. You just kind of have an automatic thought to something. Sometimes a thought will travel so quickly that you're unaware of the thought. And according to this theory, which I really believe in, thinking always precedes a feeling or a behavior. Okay? Typically, everything starts with a thought, and it can be so automatic that you don't even realize the thought in your head. You can automatically go to, oh, I'm not a good mother. I'm not a good parent. I'm not a good son. I'll never be this. I'll never do that. And that's that automatic thought, which automatically puts us in a place of thinking bad about ourselves and then usually following up with a negative behavior. So let's think about identifying some automatic thoughts. So situation, right? We talked about how situations are not changing. We're talking about a fixed situation that you're dealing with in your life. The doctor office calls. Automatic thought, something's wrong, right? How easy is it to go there, right? Especially if they're not saying, hello, Mr. Smith, can you give me a call back? We need to reschedule the appointment. So that we can handle usually. But if the doctor calls and says, Dr. Smith wants to talk to you, we usually go to a place of that something's wrong. That's that automatic thought, okay? So my question to you all, and if we were in a large room at a conference, I'd ask for the audience to say, what would be your emotional reaction to that? Usually we feel fear, worry, anxiety, panic, but the reality is we don't know what's happened yet. That's just our thinking. So underlying assumptions that we have about ourselves, others, and the world are core beliefs. They're usually often based on previous significant events. They're unconscious, and they impact our interpersonal relationships, employment, if we're working or not, view of self, and care of self. Those are kind of like, those are very important to notice about ourselves, even before being diagnosed. Put aside acromegaly for a minute. Put aside the world crisis events that are happening right now. Core beliefs are beliefs that we've learned along the way that get in the way of us being successful in meeting our goals. Again, and they're typically negative. So commonly held irrational core beliefs that a lot of my clients talk about and come into therapy about. I'm helpless, I'm weak, I'm inadequate, I'm bad, I'm unworthy, I'm unlovable, or I'm different. Ask yourselves if you feel that any of those kind of touch a chord in you that you kind of go to at times. Those are irrational core beliefs. They're irrational. They're not based on facts. So what we want to do is we want to kind of dispute these negative thoughts. Just because we believe something is true doesn't mean it's a fact, right? Right? So we really want to look at kind of our thinking. And a lot of people use the term positive thinking, negative thinking. I prefer the terms rational or irrational thinking, something that's based in reality. And this is a little tool you can use in any given situation if you find that you're not thinking rationally. So 3 questions to ask yourself regarding your thinking. Are my thoughts based on fact? Does my thinking help me feel the way I want to feel? Does the way I think help me feel the way I want to feel? And does my thinking help me achieve my goals? And I don't mean the huge, lofty life goals of where I want to be in 10 years. I'm talking about the small little goals of just getting through the day, right? Small little things. If you ask yourself those 3 questions, and if you answer no to any of these, you may want to change how you're thinking. You may want to say, do I want to keep this thought? So let's kind of try this out here. So the doctor has called you to come into the office to update you on your prognosis. Immediately we'll have most of patients will have an irrational thought. I know it's bad news. Okay, so that's like an automatic thought, just comes into your mind. So when you have these thoughts, whatever those thoughts are that you have, I'll never be good enough. I'll never be, whatever those are, I'll never be successful as him. I'll never have enough money as she does, or I'll never look like her. I'll never get past this. Those are those negative thoughts that come into our mind that I want you to start thinking about, asking yourself these 3 questions. So the rational thought is, I don't know what the news is, I'll be able to handle it. Whatever lies ahead, I'll be able to handle it. as opposed to saying doom and gloom, it's over, I'm sick again, I'll never get through this, I'm going to die. It's more like, you know what, I don't, because it's rational thinking. I don't know what lies ahead, but I'll be able to get through this. And then you'll notice if you change your thinking, and this takes a lot of hard work and a hard discipline. This is not something that happens overnight. This is more like learning how to play tennis, getting the ball over the net. It's just practicing, practicing, practicing of changing that thought and identifying a negative thought. So some of the things on how we change our thoughts, feelings, and behaviors to look at is that realize that our old way of thinking is irrational. It's not helping us get out of bed in the morning. Again, make it be small goals, especially if you're having breakthrough symptoms and you're exhausted, or you've got body aches. I mean, those are real significant situations. And if they're pretty hard to control, you've got to look at, the coping mechanisms of things that you can't control. But if you're stuck in that irrational thinking, like, I'm never going to get through life with this pain, that never is going to keep you stuck in that negative thinking and the feeling, and then staying in bed all day. Sometimes we need to stay in bed all day. I'm not saying we don't all have those days, but notice your thinking, because that is what you can change. Sometimes we need to develop a new rational replacement thought. Sometimes people call these mantras. I have one that I actually will share that I like to use often. I'll say, everything's going to be okay. That's something that's like a mantra, and that's like a rational replacement thought, like everything's going to be okay. Everything's going to be okay. A lot of times I'll repeat that in the moment if I'm not feeling like everything's going to be okay. So maybe the mantra for you is something that you develop that fits right to you to get you through the day, whatever you're struggling with, whatever situation is not changeable, to conquer some of those negative thoughts. And then part of this too is just being open to think differently, being open to thinking differently about a situation, whatever that is. So visualization is something that's been around for a long time. It's been shown to be very effective as actually doing something when learning a new skill, to visualize, being on a tennis court. And I'm not a tennis player, but this is something that I visualize, is just being able to hit the ball over the net, or how about make that basketball shot, being on a basketball court and hitting the shot, or maybe hitting a baseball, or visualizing, dancing, visualization, seeing yourself in a very positive way, conquering something that feels different. Visualizing yourself being successful at obtaining a goal, whether that's getting dressed in the morning, brushing your teeth, just like the daily basics. Sometimes when life is really hard and it's hard to get out of bed in the morning, especially when you're dealing with pain or loss of employment due to being ill, or the pandemic, stressors with family, visualizing yourself having positive communications, or taking that step to make that uncomfortable phone call. Visualization is very common among athletes, business leaders, to visualize themselves actually taking action. Visualizing yourself walking into the doctor's office, how you're going to sit while you wait, the things that you're going to say to yourself. Mindfulness is something that's has grown more and more over the last decade. Mindfulness is very different than meditation. Mindfulness is very action-oriented. You can actually Google the word mindfulness if you've never tried it. I highly recommend it. I love mindfulness because you don't have to shut down your brain, as opposed to meditation. Meditation is wonderful, but it really takes a lot of practice where you're really numbing out all the thoughts in that moment. Mindfulness is actually it's a technique for changing your relationships with thoughts and feelings, and kind of focusing on a technique where you're an active player in that moment. It's one of the things that we do that can be a wonderful mindfulness exercise is to, and again, they're on the internet that you can Google and find a lot of different techniques of being kind of doing a mindfulness exercise where you envision all the different parts of your body from the top of your head to your toes. There's also a very common one called the five senses, where you want to look at taste, smell, touch, vision, auditory. I think I named all five. And going through each of those where you're actively tasting something, where you're actively hearing something, or visualize something. These can be very helpful to reduce stress. And again, like meditation, mindfulness really grows the more you do it. And if you can do even a minute in the morning or a minute at night, or get into some kind of routine, it can be very, very helpful. So, practicing techniques, physical practice. While mental practice is useful, being physically able to perform actions is the ultimate goal. If there's the fear of speaking in public, try it anyway. If the fear is changing careers, kind of begin the action of learning a new job skill that may be helpful with the physical practice and retraining some of your thoughts and obviously your feelings around it to achieving the behavior. So what makes new thinking grow is desirability, being willing to be mindful in the beginning of just how we think. If we think more negatively than positively, looking at the advantages of reframing a thought, even if you don't believe in that, but just being open to kind of acting as if in the beginning, and repeating new rational thoughts every day. And I really encourage a mantra. I really encourage you to find something that speaks to you. You can even write it on a Post-it and put it in your mirror, put it in your kitchen. I am beautiful no matter what. I will get through today's challenges, and repeat that, visualize that, put a vision to it. These are things that can really, really help when you're in the kind of anxious preoccupation, coping phase, or you're feeling hopeless, if you're feeling depressed about things. These can really help. So we want to practice new thoughts. Repetition cements new thoughts. We want our new rational thought to have a solid foundation. So today's, presentation is really, if anything, at the end is to help you see how your thoughts connect to your feelings and connect to your behaviors, and to just be mindful about how you think about things, and being mindful and open to challenging that irrational thought and asking yourself those three questions. Is it based on fact? The way I'm thinking? Is this going to help me feel how I want to feel? And number three, is this going to get me to where I want to be, whatever that goal is? And if you're answering no to any of those three, you want to check in with yourself about how you're thinking. So, very common negative distortions, all or nothing thinking. I would love to get a share of hands of people who think this way. A common thought: if I can't do all the things I used to do, then life is not worth living. That is pretty black and white, all or nothing thinking. So maybe we need to reframe our thinking. So maybe the reality is we can't do certain things. I know there's a lot of things we can't do during this pandemic, but maybe we can reframe it to, there are things that I can do. I just have to look at new ways of adapting to them. Catastrophizing is a very common cognitive distortion. We blow things out of proportion. Now that I have this illness, my life is over. That is not a true statement. That is not a cognitively rational statement. And for those of us that go to catastrophizing, I want you to be mindful that you go there. and be mindful of it. That's the first step. And just to maybe reframe it, there's no evidence of that. It's going to be a slow recovery, or this illness is new in my life. We're certainly dealing with, the virus that's new in our life, in our society, in our culture, that we can adjust to this regardless of what lies ahead. Irrational should statements. These are very, very common. I should be able to handle this without help. I should be able to handle that. It's very common that we get into shoulds. I should have done this. I should have changed doctors. I should have gone to a different doctor, or sought something earlier. I should have had this procedure or tried this. That's past. That's the past. So let those go. Try to be focused on right now, what you can do in the moment to ask for help. Know that other people need help too. If only I had done this or done that. These are common with the I shoulds. This leads to being a victim. We want to stay out of self-pity and feeling like a victim. And it keeps you stuck in the past. You got to ask yourself, what can I do now? What do I need to do today to take care of myself? Sometimes I'll say to myself, what do I need to do right now in this moment to take care of myself? Just right now. What needs to be done right now? Keeping it really simple, being in the here and the now. Because a lot of times we live in the past or we live in the future. So be in the present. So we know we have stress. We live with a lot of stress today. All change in life makes demands on you for energy of coping and adapting. All adaptation causes stress. Keeping stressors in your life to a minimum. It really comes down to how you're going to take care of yourself just for today. You've got to get a lot of rest. You've got to have really good sleep hygiene. You can look at that on the internet. What does sleep hygiene mean? Going to bed at the same time, waking up at the same time. What are you doing for play today? If you can create some of that in your life, because a lot of that has been changing right now. Eating well, getting yourself on some kind of not a diet, but some kind of a nutritional plan that makes you feel good about who you are, makes you feel good about your body is really important. It's worth maybe paying a little money for a dietitian, or at least looking at some experts online to help with what can be good for eating. And then the most important thing, in a lot of doctors' opinion, is exercise. You don't have to run a mile. You don't have to do 100 sit-ups. It's just something through the day, maybe walking, some, leg lifts, whatever you do to get some exercise in, if you can do that, especially on the really hard days where you're not feeling well. Support groups, as you know, Acromegaly community has incredible support. I really emphasize the online support that we give you. I would really emphasize any other support groups, whether, I know right now they're on Zoom, or any in your community that you can work with. It's an opportunity to connect with others informally. The best thing about a support group is that there's a common denominator, that everyone is in the same boat. The issues may be different, procedures, medications, but especially when you share something like a pituitary disorder, which is so rare, to be in a forum with other people that you can call upon or hear their issues, whether it be acrofog or the breakthrough issues, or how to deal with family and loved ones where they just don't understand. And they can only understand to some extent. They have their own issues too. So it's coming together and sharing all of that in a safe, confidential place is very, very important. And it encourages socialization, preventing isolation, and that's the most important thing. I'm going to do a time check, everybody. We're almost at 5 o'clock. This is one of my favorite quotes that I like to end on, is that you want to watch your thoughts, they become your words. You want to watch your words, they become your actions. And you want to watch your actions, they become your habits. And watching your habits, they become your character. And your character becomes your legacy, what you teach your children and your siblings, and what passes on to create our society. So if I can let you be with anything today, I hope this was helpful. Be aware of how you take care of yourself, treat others, and be aware of how you think. It affects your feelings, and it affects ultimately the behaviors that you have and the actions that you take. Thank you very much.
Thank you, Catherine. You know, this week was a huge week. I forgot to mention it at the beginning. We got a new drug approval this week.
Yay!
It is the first oral somatostatin analog approved for our condition.
Amazing.
It's a great thing for patients. Catherine, would you mind? I'm going to stop recording. And then can we have like a little discussion?
Absolutely.
So that you know, the questions that the patients are asking isn't recorded. But if that's okay with you,
absolutely, would love that.
Okay. Thank you, everyone that's watching this via